The 7 cervical vertebrae represent the cervical spine. They have their own distinctive features, such as the low and small vertebral bodies. Also, the spinous process of the second, the third, the fourth, and the fifth vertebrae are bifurcated at the end. On the transverse process, we can find an opening, or foramen transversarium, through which the vertebral artery, vein, and sympathetic nervous plexus pass. On the upper surface of the transverse process, the groove for the spinal nerve runs.
Watch more videos in the EasyAnatomy app. With EasyAnatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download EasyAnatomy from the link in the description.
Among the cervical vertebrae, there are typical and atypical cervical vertebrae. The atypical vertebrae include the first and the second cervical vertebrae. The first cervical vertebrae, atlas, has its own features. It has no vertebral body. It turns into 2 lateral masses. Atlas has no spinous process. It is reduced and represented by the posterior tubercle. The articular processes, both superior and inferior, are also reduced, but the articular surfaces for articulation with the overlying and underlying bones are preserved. On the inner surface of the anterior arch, there is a facet for dents. It serves to articulate with the second cervical vertebra. On the posterior arch, on its upper surface, the groove of the vertebral artery runs. There are 2 pairs of articular surfaces on the lateral masses. The superior articular surfaces serve to articulate with the occipital condyle. The inferior articular surfaces serve to articulate with the second cervical vertebra. The 2 lateral masses are connected by the anterior arch and the posterior arch. Each arch has the anterior tubercle and the posterior tubercle. The large opening in the middle of the vertebra is the vertebral foramen. The second cervical vertebra, or axial vertebra, or the axis. Its key feature is the presence of the dents around which the atlas rotates. The second vertebra has the vertebral body and the vertebral arch. The spinous process, which is bifurcated at the end, extends posteriorly. The transverse processes, which have the transverse foramen, and the superior articular processes with articular surfaces extend upward from the body. The inferior articular processes with their inferior articular surfaces extend downward. From the side, we can see the superior vertebral notch and the inferior vertebral notch. The dents has an apex and 2 articular surfaces. The anterior articular surface, which connects to the facet of the atlas, and the posterior articular surface, which connects to the transverse ligament of the atlas in the formation of the medial atlanto-axial joint. The typical cervical vertebrae will be discussed using the 7 cervical vertebrae as an example. Its feature is the long spinous process. Because of it, it is called a vertebral prominence. In other respects, the structure is the same as that of the other cervical vertebrae. The superior articular processes extend upward, and the inferior articular processes descend downward. From the side, we can see the superior vertebral notch and the inferior vertebral notch. The rest of the cervical vertebrae have the same structure, and only the 6th is slightly different. Its transverse process has two tubercles, the anterior tubercle and the posterior tubercle. The anterior is called the carotid tubercle. The reason is that during first aid for the bleeding from the carotid artery, this artery is pressed against the carotid tubercle. Between these tubercles, the groove for the spinal nerve runs.